Hi everyone, welcome back to my YouTube channel and today we are going to talk about squamous cell carcinoma. So let's start our topic with introduction. Squamous cell carcinoma is type of malignant tumor that arises from squamous epithelium, which is the fat, thin layer of cells that is found in skin and certain mucous membranes. Squamous cell carcinoma is the second most common form of skin cancer after basal cell carcinoma. It can occur on the skin as well in the mucous membrane of the mouth, throat, esophagus, lungs, and cervix. The disease is characterized by uncontrolled proliferation of squamous cells leading to invasive growth and potential metastasis. Epidemiology of squamous cell carcinoma. Squamous cell carcinoma is more common in older adults, typically over the age of 50. The incidence is higher in individuals with fair skin who have prolonged exposure to ultraviolet radiation. Men are more frequently affected than women. And immunocompromised individuals, such as organ transplant recipients, are at the higher risk for squamous cell carcinoma. And also, occupational exposure to carcinogens like arsenic or industrial chemical increase susceptibility of squamous cell carcinoma. Etiology of squamous cell carcinoma. The development of squamous cell carcinoma is multifactorial, involving environmental, genetic, and immunological factors. Common causes of squamous cell carcinoma include ultraviolet radiation, as chronic sun exposure is the primary risk factor for cutaneous squamous cell carcinoma. Second common cause include human papillomavirus, as certain strains, especially human papillomavirus 16 and human papillomavirus 18, are linked to mucosal squamous cell carcinoma. Third common cause for this is chronic irritation or inflammation, as non-healing wounds, burns, scars, or chronic ulcer can predispose to squamous cell carcinoma. Another common cause is chemical exposure, as prolonged exposure to arsenic, tar, or certain industrial chemical increase the risk of squamous cell carcinoma. Fifth factor is genetic disorders, like conditions like xeroderma pigmentosum leads to defective DNA repair, thus increase the squamous cell carcinoma susceptibility. Next common cause for squamous cell carcinoma is immunosuppression, as patient with weakened immune system has a higher incidence and more aggressive disease. Now let's talk about pathophysiology of squamous cell carcinoma. Squamous cell carcinoma arises from squamous epithelial cells through a process involving DNA damage that is commonly from UV light or chemical carcinogens. And that leads to mutation in tumor suppression gene that is like TPF353 gene, and that cause activation of oncogenes. As a result of this, there is loss of normal cell cycle control, and then these molecular changes lead to abnormal proliferation, invasion of surrounding tissue, and in advanced cases, it can lead to metastasis to regional lymph nodes or distant organs. The carcinoma typically begin as a precancerous lesion called actinic keratosis in the skin. Now let's talk about clinical features of squamous cell carcinoma. Clinical presentation of squamous cell carcinoma depends on its location. Like in case of cutaneous squamous cell carcinoma, the lesion look like firm red nodule or plug. It may be scaly or crusted surface, and the lesion is mostly non-healing ulcer or sore, and this lesion can bleed easily. It often occurs on sun-exposed area like face, ears, hands, or scalp. Then there's another type of squamous cell carcinoma, that is mucosal squamous cell carcinoma, that may be oral, pharyngeal, or esophageal mucosal squamous cell carcinoma. It clinical presentation is like persistent mouth ulcer or sore. There is pain or difficulty swallowing as because of the ulcer. There may be white or red patches in the oral cavity. There may be hoarseness of voice changes if larynx is involved. And in case of advanced squamous cell carcinoma, it may present pharyngeal lymphadenopathy, indicating metastasis. Diagnosis of squamous cell carcinoma. Diagnosis of squamous cell carcinoma involves a combination of clinical examination and laboratory investigation. First, it includes physical examination that include inspection of skin or mucosal lesion, assessment of size of lesion, assessment of shape of lesion, and assessment of texture of lesion. On second step, we do the biopsy. That is a definitive diagnosis, and it is made through histopathological examination of tissue. Common types of the biopsy include incisional biopsy, excisional biopsy, or punch biopsy. Depending on the type of lesion, we do the different type of biopsy. Third step we can do for diagnosis is imaging studies like CT scan, MRI scan, or PET scan may be used to assess local invasion and metastasis. Then we can also do laboratory tests that include blood tests that are generally supportive but not diagnostic. And human papillomavirus testing may be done for mucosal lesions. Histopathology of squamous cell carcinoma. Microscopic features of squamous cell carcinoma include keratin pearls that are concentric layer of keratinized cells. It includes atypical squamous cell with enlarged hyperchromatic nuclei. It includes loss of normal epithelial differentiation and invasion into underlying dermis or stroma. Also, there is presence of mitotic figures in the squamous cell epithelium. Treatment of squamous cell carcinoma. Management of squamous cell carcinoma depend on tumor size, location, depth, and metastatic spread. First we can do is surgical excision that includes complete removal with clear margins in the and it is the treatment of choice because it prevent the recurrence rate. Then we can also do is most micrographic surgery that is particularly for facial lesion and it preserve healthy tissue while ensuring tumor free margins. We can also do radiation therapy for squamous cell carcinoma that is used for unresectable tumors, high risk area, or adjuvant therapy. It can be also used as adjuvant therapy. Fourth, we can also do is cryotherapy that is for small and superficial lesion. Fifth, we can also do topical therapy that includes imiquimod or 5-fluorouracil for precancerous or superficial squamous cell carcinoma. Sixth, we can also do is chemotherapy and immunotherapy that includes advanced or metastatic squamous cell carcinoma and it may require systemic therapy including PD-1 inhibitors. Prognosis of squamous cell carcinoma. Early stage squamous cell carcinoma generally has an excellent prognosis with surgical treatment. Risk of recurrence and metastasis increase with tumor size, depth, poor differentiation, or perineal invasion. Like if these things are present, there is the risk of recurrence increase with these things. When tumor size increase, risk of recurrence increase. When depth of the lesion increase, risk of recurrence increase. Same like for poor differentiation or perineural invasion. Cutaneous squamous cell carcinoma has a 5-year survival rate of around 90% if detected early. Mucosal squamous cell carcinoma tend to have a worse prognosis due to late detection and higher metastatic potential. Prevention of squamous cell carcinoma. First we can do is limit sun exposure and use broad spectrum sunscreen. Second we do is avoid tanning beds and chronic exposure to carcinogens. Third we can do is the regular skin checks for suspicious lesion, especially in high risk individual. Fourth we can do is prompt evolution of chronic ulcer or non-healing wounds. Fifth we can also do vaccination against human papillomavirus that can reduce mucosal squamous cell carcinoma incidence. Conclusion of this lecture video. Squamous cell carcinoma is most common malignancy of squamous epithelium, most often by UV exposure and other environmental or viral factors. Early detection and treatments are key to favorable outcomes, and with advances in surgery, radiotherapy, and immunotherapy, the prognosis for localized squamous cell carcinoma has improved significantly. Preventive measures and patient awareness remains critical for reducing incidence and mortality of squamous cell carcinoma. And this was all about squamous cell carcinoma. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.